Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? You guys know last week I asked you, who do you want me to interview on the show? And I had so many of you want Dr. Brian Rosett on the show. So of course I shot my shot and it landed. So welcome to the show, Dr. Rosett.
Thank you for having me.
I'm excited to have you on. You have such passionate patients. They love you. And I weekly get requests to interview you. So I'm really excited to have you on the show. And our subject for today is something that you do all the time. And it's probably one of your favorite procedures, tummy tucks. We're going to talk about everything tummy tucks. So I want us to really treat this kind of like a consultation, information that our girls would hear at an initial consultation, but they're going to hear it from you. So let me ask you one question and then we'll go from there. So when a patient comes to your office and they present to you and they say, you know, I don't like my abdomen. How do you distinguish between a patient who needs a tummy tuck versus a patient who just needs liposuction?
Totally. So I think that is definitely something I see a lot of. And thank you for having me. And I guess thank you to all of my patients who requested me. I really appreciate it and love all of them. So I think that is definitely a big question that people have. I definitely have a lot of people who want one and they come and we talk and they leave going with the other one. A lot of it comes down to what we need to do in order to get the result that they're looking for and what they're starting with. So if you have an older patient, skin quality not that good, lots of stretch marks, rectus diastasis, so they have laxity, mostly from pregnancy or from significant weight loss, then those patients really need the components that you get with a tummy tuck. And that's a muscle repair and removing all of that excess skin. I use the example in the consultations like a slinky for the patients who are older, who probably are in the group that need the tummy tuck. They'll understand. You can pull a slinky so far and it goes back and sits, you know, nice and normal. But when you pull it too far, then it kind of gets wonky and it never goes back how it was. And it's sort of the same with your collagen fibers in your body. If you pull it too far, if you stretch it too fast, then they never go back down. And patients will say, when I was younger, I could gain and lose weight and, you know, my body always snapped back to what it was. But now I'm losing all this weight and the skin is just there. And those patients aren't going to do as well with liposuction. Obviously, it's a part of the procedure, but the most important part is removing that excess skin, tightening the muscles so that they get a waist. Doing the parts of the tummy tuck is what they need. Now, contrast that with someone who's younger, hasn't had significant weight fluctuations, generally hasn't had kids. They have a more toned skin quality. They don't have stretch marks. That patient's going to do better with liposuction because really what we're counting on is we're removing the fat and we're letting the skin tighten back down over what is left. So it really comes down to what they need, what they're looking for. I definitely have patients, and I have a great picture that I show patients in my consultation of a patient who came to me. I recommended, she was a little older, she had stretch marks, she had a little bit of loose skin. And I said, we need to do a tummy tuck. And she said, I really don't want it. I don't have the downtime. I'll be happy if I just go down a couple of dress sizes. I don't plan on ever wearing a two-piece bathing suit again. And so we did liposuction, and there's a huge improvement. She lost, I don't remember if it was 4 or 6 inches, definitely much better, wears, you know, a one-piece bathing suit. But then a year later, she came back to me and she said, you know, I was thinking about it. I really do want to wear, you know, a two-piece bathing suit because I feel like I could get there and the loose skin isn't really what I want. And so then we did a tummy tuck. And I have a great set of 3 pictures where it was before, after the liposuction, and then after the tummy tuck. And it really shows for a patient who needed a tummy tuck what we went through. And there's no downside to doing it stepwise. I never hurry a patient along. I never push them to do something they don't want. I tell them what we're going to end up with. As I told that patient, we'll probably have loose skin. And if we're in agreement about the results, then that's okay. But I think really it comes down to what your skin is and what you're looking to get out of the procedure.
Do you find that a lot of women are shying away from the tummy tuck scar, or are they?
No, I honestly don't think so. I feel like, and maybe it's just because of the procedures that I do and what people see, in order to get that look of a tight waist, of tight skin, that's sort of what you need to do in plastic surgery. We trade a shape for a scar. And really what you want to find is somebody who does nice sewing, puts everything together well, and leaves you with as light or thin or low of a scar. And what you really want to do is, put it in a place where it hides so it doesn't creep out of a bathing suit, so that you can wear a 2-piece bathing suit and it doesn't show. My goal is always that people wear, something sexy and nice, and they don't have to worry about the scar. I feel like you could get away with a 2-piece bathing suit that looks like boy shorts and hide most anything, but you really want them to be able to wear a nice bathing suit that's thin and get away with it. And I think people understand that the results that they're looking for require that kind of surgery.
It absolutely does. So what do you recommend for your patients for post-op care after a tummy tuck?
So post-op care, part of my surgery is definitely a tight plication, so a tight muscle repair and tight skin excision. So I definitely want people bent over when they're walking for those first 2 weeks while everything is healing up. And when they're in the consultation, I show them, I say, bend forward, and I take their shirt and I pull it down first. And I say, okay, now bend forward a little bit. And then they see I get another 2 or 3 inches of shirt that I can pull. And then while I'm holding it there, I say, now stand up. And they see that it pulls on their t-shirt. And I said, this is what it's going to be after surgery. So super important for you to stay bent over, be on top of their drains, not a lot of activity. When you do a tummy tuck, you're basically separating the layer from the muscles and the fat in the skin. Those two are separated where they're usually stuck together. Then what I do is, or what anyone does when they do a tummy tuck, is they cut off all the extra and then sew it back tight. The reason that I use drains is the body naturally, when something is not stuck together, sort of like a blister. A blister is when you rubbed on your skin and the layers separate a little bit and it fills with fluid. So you're going to get that fluid filling that area that we've worked on. The drains help take the fluid out while those 2 layers stick back down. And then once they stick down, the fluid goes down, we take the drains out, everything is great. You can go back to doing your activity. So I really want people to take it easy. I find that there are some people that they come strolling in, the pain medicine that I give them works pretty well and they're not having significant discomfort. And I really have to tell them they have to slow themselves down. Well-balanced diet, plenty of protein. There are protein supplements that you can take, and then plenty of water just to replace all of the fluids that you've lost. You're dehydrated to start from surgery. We take a fair amount out, even though we give you IV fluids, but plenty of water, good protein, taking it easy, staying bent over. Those are the big ones that I tell people to do.
You touched on something that I have talked about.
I have an idea where we're
episode. Okay. I had a previous episode with my very good friend, Annalisa, who's also a coordinator, and she's team no drain and I'm team drain. I want drains. My patients, I want y'all to have drains. So her rebuttal to me was that with drains, there's a higher infection rate. Can you debunk that for me, please?
I don't think that there is a higher infection rate. So what I think people are thinking is infection, I think is irritation at the drain site. It's rare that I have to put people back on antibiotics because of the drain that's in. Generally, what you get is if someone has that drain in for longer than 2 weeks, then they start getting some redness and irritation at the drain site. But what I am afraid about, I actually had a patient a couple weeks ago said, is it a better and easier recovery without drains? And my response to that was, it's not as good of a recovery, but it is an easier recovery. I think the drains are a little bit more difficult. It's, it hurts if you pull them. It's annoying to have things hanging off you, even though I show people ways to deal with that. But really getting that fluid out, I think, is super important. And I think even the people who came up with and wrote the paper on drainless tummy tucks, they still had almost a 20% chance of developing a fluid collection. And the problem is, if you develop that fluid collection, you're going to be coming into the office twice a week to 3 times a week for anywhere up to 2 to 3 months getting that drained out with a needle. So in my opinion, and especially with patients who are driving from far away or from out of town, I really feel safer with having a drain in. It gets all that fluid out. And I think that generally 2 weeks and they're done with it. And we don't have problems with fluid collections or what they call seromas.
What can you tell our listeners what a seroma encapsulated means, or an encapsulated seroma is?
Yeah. So the body naturally forms fluid, and that fluid eventually, if it is left, forms basically like almost like a water balloon around it. And the edges of that water balloon form more fluid. So if you leave a fluid collection or a seroma and it becomes encapsulated or it forms a wall around it, then it's a lot harder to deal with because you'll drain it, and the cells that are on the inside of that wall will make more fluid. So generally those patients end up seeing interventional radiology. So a group of doctors who will put a drain in there, they'll put something in there that will irritate it to try to cause it to stick and stop making fluid. But really a majority of those patients end up getting reoperated on. So you take that cavity out so that it can stick back down.
So team drains 100% all the time. Y'all heard it from me, and Dr. Rosett, he likes drains too.
Yeah. I mean, don't get me wrong. There are definitely doctors out there who are team no drain. And I have a bunch of colleagues who, we have this conversation not infrequently. And, really, I think the important thing that I tell my patients is you need to find a doctor who, and this comes back to consultants. I hate to say this because you just said one of your good friends, but I really think the best thing, I came from a place that used consultants, and I think it ends up having a lot of misunderstandings. You have patients who come in and the procedure isn't exactly the right thing. You really want to meet with the doctor who's doing your surgery. And if you're not, I don't think that is the best option. You want to talk to the doctor
every time
and show him. Yeah. And you want to show him or her what your concerns are. And they themselves know from experience what they can do, what they can't do, and telling the patient what I think I can do and what I can't do, and hearing from the patient what they want and what they don't want allows us to come up with a plan that makes them happy. And that I think is the number one thing that you need. And if you're not talking to your doctor, you're talking to somebody who usually is paid to sell more surgery, but doesn't do the actual surgery. So they don't know exactly what I can do and what I can't do, even if they've worked with me for a long time.
You know what? I think this really leads into my next question, which I want to point out. You were recommended, and your girls love you. And I think that has a lot to do with how you run your practice. And the way you run your practice is not the conventional way. So what makes your practice different?
So it's very different. And I think a lot of it came from where I have been before and where I came and what I wanted to do. I really wanted a very personalized feel. I jokingly say, a 1940s or, like old TV land kind of feel with the town doctor, where I do the majority of the patient interaction. We generally have somebody at the front desk who will bring patients into a room, offer them something to drink if they want it. Right now, we're looking for somebody new for that position because our last person went back to school. But for the most part, I'm doing the patient interaction. And I feel like patients they get my cell phone number after surgery. They just text me directly. I text them. The average person, I would say, after surgery hears from me probably 6 to a dozen times in that first week. And it really depends how they're doing. If they need more, they need less, but I'm always available to them. And, patients are very reasonable about the fact that, I have a fair amount of patients. And if they called about everything, then it would be tough. But I feel like people have been very good about being reasonable, about texting me if they have issues. That first week, I totally understand it. It's a lot. There are questions. There's things you don't understand. But I feel that if there's an issue, instead of going through an answering service, waiting, for them to get a hold of a nurse, and then the nurse may call, and then the doctor, this way they call me directly. I answer the question. We're both back in bed in less than a minute. And I think that people really have responded well to that.
Yeah, I'm sure they do, because I hear it from them all the time. They love how much you contact them. Like I hear it in my DMs. He texts me the night of surgery. He texts me the next day, very attentive. And I think that's really important because, you know, a theme that I have on the show is you have to have a great relationship with your surgeon. It's like picking a partner. There's a lot of options and you have to find the right one for you. And one of those things that to me is very important is a doctor who is available to answer any questions that I have, especially in those first few weeks. So let's answer this question. What are some post-op complications that are, I don't want to say normal, but more common versus when a patient should be like, okay, maybe I do need to go be seen?
Well, totally. And that's one of the reasons that I'm always available. So there isn't the worry overnight. Before, when I was at other practices, patients would say, I was up all night worrying and I didn't know what to do. And I was like, so when I did this, it's like, just call me, text me, it's fine. What complications can happen with surgery? Obviously, surgery is not without complications. So generally starting at the least bad and going to the worst, pain, bleeding, infection. If I cut someone's skin or you cut your own skin, your skin is basically your shrink wrap. It keeps your insides in and your outsides out. Anyone who cuts the skin, that's, one of the possibilities, pain, bleeding, infection. Obviously, we do lots of things to prevent each of those. Moving on from there, we talk about scarring. Obviously, our goal is a thin little line that fades to being basically imperceivable after, a year or two. But, there's dark scars. There's scars that can widen. They can be thick. You can have a hypertrophic scar, which is where the scar raises up and stays within the boundary of the scar. Or you can have a keloid, which looks like a little worm and it could be a big worm on top of your incision. And all of those can be fixed with steroids, with silicone tape, and worst case scenario, we cut it out and we start over and we are a little bit more aggressive with that stuff. Moving on from there, you can have wound breakdown. So you can have a little, what they call like a suture like breakdown. So those sutures that are under the skin are dissolvable. And in order for them to dissolve, the body forms some inflammation. Sometimes that inflammation works its way to the skin and you have a little, probably like a quarter of a centimeter little hole where that stitch is working its way out. And typically you can grab the stitch and then it heals up pretty quick, or, it kind of takes its time. You could have a larger opening. You can have the skin can die from the amount of tension that's on it. The skin can die from doing too much liposuction at that same time or doing too much surgery at that one time. All of that stuff will heal. It does happen to every surgeon. You end up seeing somebody to help you do some wound care. It's a couple of unfortunate weeks. And then once it's healed, you can go back in. I feel like 60-40, people generally heal pretty good, even in the worst of situations. But the ones that don't, you go back in, you cut the scar out, and you can almost not even tell that it happened. Moving on from there, we talk about blood clots in your legs. And then the worst complication that can happen is a blood clot in your leg that goes up to your lungs. And that's a pulmonary embolism, and that can be fatal. So really the things that I tell my patients I want to know about right away: fever over 101.9, 101.6. If they're incoherent or hallucinations, pain that is not getting better with their pain medicine, any skin that's red and hot to the touch, drainage from their incisions. I tell people you will have drainage. It will be red. If you put a couple of drops of blood in 2 cups of water, it'll look like 2 cups of blood. But if it's more like Kool-Aid and it's thin and it's leaking out and it's not like Jell-O, then it's probably the tumescent with some blood mixed in it. And that's okay for the first 24 to 72 hours. There are some doctors who close their incisions from their liposuction. Some leave them open. I leave at least one open here and there just to let that drain out. I think people heal faster. So red drainage, okay. Jell-O where it's clotting, not okay. I want to know about that. And any shortness of breath or leg pain or leg swelling, all of those are ones that I tell my patients, I don't care if it's 2 p.m. or 2 a.m, you wake me up and let me know and we're going to deal with it. So those are the 5 things that I think I really want to know about right away.
I love that. So do you have, for our listeners who are worried about a DVT, what prevention treatment do you offer?
So it's not an off, it's a required for everybody. So on tummy tucks for DVTs, they get compression socks. So really what happens is anesthesia causes your blood vessels to relax while you're sleeping. Blood will just sit there and pool in your veins. So what we want to do is minimize that. And the ways we minimize that are compression socks. So that keeps everything squeezed so the veins can't dilate as much or open up and let the blood just sit there. Then there are things called sequential compression devices. So basically what they call squeezy boots. And what they do is they squeeze one leg, squeeze the other leg, squeeze one leg, squeeze the other leg. And it helps push the blood out of the lower extremities. And then during surgery, patients get a blood thinner injected into them to decrease blood clots. And then afterwards, I give patients blood thinners for the next week to 10 days to help even more decrease that. The last thing that we do is that I want patients up and walking around a little bit every couple of hours. The other big thing that causes blood clots is immobility. And by having people even just stand up, walk around their kitchen once or walk to the bathroom and get their pain pill, I really like when patients put their pills 20 feet away from them. So they have to get up every couple hours. And that really helps minimize blood clots because you don't want to just be laying around because that's when the blood is going to be pooling.
Perfect. How long do you require your patients to stay out of the gym?
Out of the gym 6 to 8 weeks after a tummy tuck. If it's liposuction, it's a little bit less. If it's a different surgery, it's also, everything is going to be dependent on what they have done. And again, what makes the practice nice is that patients are not just a number where we're doing the same thing for everybody. You go to some of the places where they're doing 20 people a day, 10 people a day. Everyone gets the same labs. Everyone gets the same pre-op clearance. Everybody gets the same restrictions. Everybody gets the same everything. But here we're doing different things and everything is going to be based on how the surgery went, how tight it was, and I say generally that, but I guide people along the way in the practice so that they really feel comfortable and they know when they can do what they need to do.
Beautiful. How often do you see them after surgery?
So as many times as they need. Generally speaking, I will see patients a couple of days after surgery to check on them. And then it's usually about once a week for the first 3 weeks. Once we get all the drains out, then we can start spacing things out. I generally go about 3 weeks, then 3 months, 6 months, a year is the typical. But there are some people who want or need more, and that's totally fine. I don't charge for post-op appointments. If patients need more time, then I make more time for them. And we sit and talk and whatever we need to do to make them feel good. The goal is not just a great outcome, but it's a great experience.
You know what? I see why your patients are obsessed with you. I see it. They get that personal touch, which, that's what we need. We need our handheld because I know for myself, even though I've seen it 100 times when it was, or more than 100 times, thousands of times, when it was me, it felt totally like the end of the world.
Totally. And I've had surgery before too. And I think it's really, really, I think it's great. I've had surgery twice and I think it's really, really important, not important, but it's a good experience for a surgeon to be on the other side of it and to be on the table and to feel the nervousness and to feel all the emotions that go along with it so that they remember that, for us, we do this every day. It's just another day at the office, I hate to say,
Mm-hmm.
but to this person who it's like they've saved and they've prepped and they're ready and
they've been waiting.
Right. It's a lot of emotions. It's just a lot. And until you had surgery and been in that position where you feel vulnerable, I don't think that you really can remind yourself that this is a person who this is like a huge event in their life. And I think that having had surgery twice really, reiterated that to me. Even the first time it was eye-opening and the second time was just a reminder, hey, come on, you have to treat people how you want to be treated.
I love it. Because I definitely live by that philosophy. Well, your girls submitted questions for you.
Uh-oh.
They have some questions. They want to know, what is the most amount of skin that you have removed and or the craziest surgery you've ever done?
So that would be one and the same. While I was in training, I'll actually let you guess. Pick a crazy, amazing amount of tissue to take off of one person in a tummy tuck?
Oh my God.
Take a guess.
I'm going to say like maybe.
And then wait, hold on. And then double it. We'll go with that. We'll give you a fighting chance to get this right.
I was going to say like 16 pounds. So double that. Is that right?
So wait, what was your guess?
Maybe 15, 16 pounds.
Okay. So I should have said.
Triple it.
God, I can't even. No, that's still not even close. It was 99 pounds.
What?
Yeah, it was pretty incredible. It was a very long surgery. I can only imagine that after taking that weight off, the guy can jump 20 feet at this point. But yeah, it was pretty impressive.
Wow. That is a lot of skin.
Yes.
So what was his story? How much weight did he lose?
It was more from fluid that eventually accumulated and it just pulled on his stomach or pulled on the abdominal skin and just filled with more and more fluid. And so it was basically to the point where it was touching his feet.
Oh my God. Wow.
Yes.
Life-changing surgery right there.
Oh, yes. And maybe that was the moment when I said tummy tucks were going to be my thing. I don't know, but it's definitely something that stays with you.
Well, that's interesting that you say that because your next question from your girls is what made you want to be a plastic surgeon and what is the most rewarding part of your job?
So I pretty much went back and forth between surgeon and chef. My dad's a surgeon, so I always had that experience. And then I always liked cooking. My mom was an excellent cook and I would be in the kitchen with her. So when I told them I wanted to be a chef, they were, great. And they said, well, who's the best chef in Chicago? And I told them, and they said, well, call him up and ask for a job. This is 14-year-old Brian. And I was like, I can't call him. He's famous. My dad's like, call him up. It was a little bit more colorful than that. And so I did. And I worked there for a couple of days. It was down in the city. I lived in the suburbs. My parents had to drive me. I didn't have a car, but eventually got a job at a restaurant nearby where I grew up and worked there for all of high school on the weekends. So I pretty much did that straight through, went to France, cooked there for a summer, and then came back and decided I wanted to be a surgeon like my dad. So I did my pre-med courses. I went into general surgery residency like my dad was and did that. And there were a lot of things that I really liked. I always liked making things look good, making things look pretty, making things look orderly. So that always kind of came naturally. I have very nice handwriting, people will say. So fine motor skills were not a problem for me. And I was always very bad at giving bad news. I was very emotional about telling someone something bad. So I would be the one crying, giving bad news. And the family member who I'm supposed to be consoling as the doctor is consoling the doctor. And I was like, okay, this really does not work. So it all works together very nicely that I like making things look pretty. I like happy things. There's nothing better than a patient sending you a picture. Hey, this is me in a bathing suit, or this is me in a dress I haven't worn in 15 years. It's all high.
Rewarding.
For the most part, plastic, the aesthetic surgery that I do right now is very, high five, happy. For the most part, my patients are super happy and I don't have a lot of those low moments. And I very much appreciate the people who are oncologists or who do the stuff that's emotionally tough. I don't have that ability.
I am right there with you. I'm a big baby. I cry a lot at sunsets and sunrises. So I'm right here with you.
I'm with you in commercials. I can cry at a commercial.
Me too. I cry at commercials all the time. I love that. That's, how you found your way. It's interesting that you touched on general surgery because my next question, I think, kind of goes into that. So there are some surgeons who will do a hernia repair during your tummy tuck, but there's some surgeons who don't. So what's up with that?
So I think it all comes down there. I think there's a lot there. It's comfort level. When was the last time anyone has done that surgery? It's location. There are some hospital systems that say that that's not what plastic surgeons do, even though some plastic surgeons do it. And it really comes down to comfort level. Is the doctor comfortable with doing that? For me, if I see a small hernia while I'm doing a tummy tuck, I have no problem with fixing that. If somebody comes in with a really large, notable hernia, then I'm going to send them to have that fixed before we do our surgery.
Okay, that's what I was wondering because I have a patient just like that right now with a hernia.
Yeah, something small that doesn't have a lot of scar, doesn't have a lot of adhesions. It's not going to add a significant time frame onto our surgery. The other thing is if you're doing a large hernia, those patients you generally will keep overnight in the hospital and maybe keep for a couple of days. When you start touching people's intestines, they basically kind of go on strike and they stop working for a while. So the hospital is much better about getting people back on track than you are by going home. So if it's a patient who needs that kind of large hernia where you're opening it up, you're touching intestines, then I'll probably refer them to somebody to do their hernia beforehand.
Beautiful. So this is my last question from your girls. How do you measure growth as a plastic surgeon? Do you measure your, like how the procedures are done? Do you measure by how far booked you are? How do you measure growth?
God, that's a great question. And it's so funny when I'm very close with my sister. When I told her I was doing this with you, she started rapid fire throwing out random questions. She's like, you got to be able to think on your feet because you don't know what she's going to throw at you. But that one wasn't one of the ones she threw out there. I'll have to talk to her about that.
I love it.
So how do I measure growth?
Referrals?
No, because honestly, I would say 90% of my business is personal referrals. I don't do any advertising. So advertising is not something that I look at. I went from having one OR day every other week with one surgery on it a year and a half ago to 2 surgeries a day every week to soon it's going to be 2 surgeries 2 days a week. And I think feeling the practice get larger, feeling the need, feeling all of that feels like growth to me.
That's perfect growth. That's describing it right there. You're growing as your patient base grows, and your patient base is growing by referral. And I mean, that's beautiful right there.
And honestly, I teach a couple of surgeons. I've taken 3 people through how I've grown this practice, how I've done it, and how they can do it, and how I run a practice. And I kind of mentor a couple of people on how they can start a practice, how they advance and all that stuff. And when I think about it, I'm like, oh, this wasn't, I didn't really do that much. But in going through it with them, I'm like, wow, there have been a lot of steps that have been taken. There's been a lot of work. And I always kind of joke that, oh, I don't work that hard. But when I look back and I'm like, oh, wow, it was a lot of work to get here, but it was good work. And I think that having happy patients and having the base that I have really makes it feel good.
Your patients, just the fact that your patient base is mainly referrals from happy patients, like that speaks volumes, because a lot of, I feel, practices who do really good marketing, but don't have, that personal touch. I don't really know how to explain it.
Yes, you can 100% build a practice. There are definitely practices that are not good, that spend a lot of money. And I don't mean to talk bad about anyone, but there are definitely practices that the doctor doesn't see people until the day of surgery. The doctor doesn't see the patient after surgery. They don't really post, pictures, but you can overcome any of that with enough money in advertising.
That's true. And as a patient, for me, the most important part of this podcast is teaching our listeners how or what to expect or how to set their standards high so that when they come across something that is not like other places are not doing it like this. For example, one of those things that from my very first episode, I have always said, if you are meeting your surgeon for the very first time, the morning of surgery, in my personal opinion, you're not in the right place for the type of care that I would expect or what I would want for my patients, for my mom, for my sister, for anybody, for my friends. I want them to have, a personal touch. I want them to feel not like another number. And if you're meeting your surgeon the morning of surgery, one of those things that actually happened recently was a patient who planned her whole trip to Miami booked her Airbnb, booked her recovery, booked her flights, booked everything. She was going to be down there for 2 weeks. Shows up the week of her surgery, a couple days before her surgery. They changed her doctor, which, what? You're going to change my surgeon without me changing my surgeon? You're changing my surgeon for me? Okay. Besides the fact, okay, they changed her surgeon the week of surgery. She shows up the morning of surgery and she's meeting this person. She had already paid for Lipo 360 BBL. And the surgeon is looking at her and he's like, that's not the right surgery for you. You need a tummy tuck. And since everything had already been done, like everything was already done, she was already there, like naked in front of him, ready to get on the table. They did the procedure she had already paid for, which in my opinion is like, how? Why would you do that? Those are the types of things that can happen.
If you do the wrong surgery, you're not going to get the results that you're looking for. And I think it's important for people to realize that if you're going to these places that are charging, rock bottom prices for surgery, there's a good chance that the doctor is not even doing the majority of your surgery. I have a friend of mine who calls it CAL, and she jokingly says it's Cuban assisted liposuction, as opposed to some of the other versions of liposuction. And it's, when you have patients who go and they're sitting there to go back for surgery and there's one doctor there, but there's 4 girls who are having surgery at the same time, that should be a red flag that how is one doctor doing 4 people at the same time? The doctor is not doing your surgery. He's jumping from room to room to room and someone else is doing the majority of the work.
Exactly. So one of those things, meeting your surgeon the morning of surgery, to me is a huge red flag. And I really appreciate, your practice and the referrals from your patients, because I'm telling you, they've been reaching out to me for months telling me to interview you. And it wasn't until recently that I think their Facebook group found out that I was looking for, okay, who am I going to interview for tummy tucks? And they were on it. It had to be you. It had to be you, according to them. And now I see why.
I really appreciate, I can't tell you how amazing the group of women who are part of the Facebook group have been. I think that's a lot of the patients that I get is from them saying good things. And if it wasn't for them, then I would not be in the place where I am now.
Beautiful. Okay. So this is my last question. Your girls want to know, what do you do for fun?
What do I do for fun? So I still cook for fun. That's where it all started, and it still goes that way. So I'll come home and I'll cook, alone, or I'll cook with family. I like doing that. That's relaxing. I'm renovating a new apartment. I've been living in 600 square feet since the pandemic started, so I need a little bit more room. So I'm deep in renovations and doing stuff for that. And really, I spend a lot of time. I know it's not relaxing, but it's what I spend a lot of time on, and trying to make the practice better, finding ways to make it better, more efficient, more customer friendly, more, what paperwork or what, I give patients a recovery mantra that talks about all the emotional side of plastic surgery and recovery and all of the emotions that they're going to feel. And I feel like when people know that it's going to be emotional, there'll be days when you'll be happy. There'll be days when you're sad. And if you're, angry or all this stuff, that's normal. And knowing that it's normal, I think helps people get through it. And I think stuff like that is the way that I try to, I'll sit there while I'm watching TV at night, and I'll be working on, some new paperwork or some new something to make the experience better. So I spend a lot of time doing that. Dedication.
What is this? You have a sheet? Is it a handout you give with how they could feel? I'd love to see.
Oh, I'm happy to share with you. It's basically, I call it the recovery mantra. And it basically says, every day is a new day. There's going to be ups, there's going to be downs. You're going to be happy. You're going to be sad. Just, remember that every day you're one step closer to your goal. And the days that are bad, if you're sad, if you're angry, that's not abnormal. Try not to take it out on, people who love you and who are there for you. There's going to be a lot of bumps. I don't want to say there are bumps along the road. There's swelling, there's healing. Everything takes its time, and you just have to let the process go. And and get to the next day. And usually I find that nights are worse and mornings are better. When it's bright and sunny out, people are generally not, sad or feeling depressed. On days when it's cold or rainy or dark, I find that people are a little more sad. And I tell patients, hey, read this if you're feeling emotional. If you get to the bottom here and you're still feeling emotional, call me. I'm your cheerleader. I will get you through it. And we just got to get you through till the next day. And the next day will be, generally better. So it's just about setting expectations, letting people know that this is part of healing, part of recovery, part of surgery. And when they know that, I feel like it doesn't catch them by surprise. And when they do feel it, they're like, oh, this is what the doctor was talking about. Okay, I can get through today. I'll wait till tomorrow, and then tomorrow is better, and then they move on.
That's so interesting that you have that, because I'm going to give you guys an example of one of my very good friends who she knew what she was doing. She knew, she got prepared. She prepared her home. She prepared everything. She had her surgery the day before yesterday. Today, she was not day three, she was not feeling it. And I reminded her, hey, we talked about this. Remember, on once the pain medication or once the anesthesia starts to wear off, your Exparel starts to wear off, you start to feel more pain, you start to feel regret. Like, what did I do? How long is this going to last? I mean, you really have to work through it. And it's beautiful that they can actually call you because you can walk them through that.
Yes. But I think that explaining exactly what you said to her, going through that beforehand and talking about it and having them read, so that they know that this will happen. This happens to the majority of people. When they know that it's a possibility, then I feel like knowing is the best first fight to getting rid of it.
Do you find that patients who have a history of maybe like postpartum depression or depression in the past are more, because, have you heard of post-op depression? Have your patients told you?
I get people who are almost more like post-op blues or something along those lines. I don't feel like patients fall into that same kind of depression, because as they heal and they start seeing results, then I feel like I had a patient who recently had a little bit of a rough early recovery, and I saw her back at the recovery house. And the first thing I did was, give me your phone. Let me just take a picture of you, because it was a real rough 2 or 3 days. And I gave her the picture and she's like, oh my God, like that just totally renewed my spirit, my ability to get through this. And really, I think that when you start seeing the results and you start seeing that your waist starts getting tighter and tighter and the swelling is going down, I feel like that kind of goes to the wayside because the excitement takes over in that situation.
You are 100% right. They start thinking, hey, I could start shopping.
Yes, exactly. Or, hey, oh my God, I've never had a waist this small or tight, or all that stuff that they were expecting starts showing up and starts getting better and better by the day. And I feel like all of that, like questioning and potential sadness, just kind of, they forget it.
That's true. It kind of fades.
But if they don't, that's what your doctor is there for. It's, hey, if I got to grab some pom-poms and do a dance to get you motivated, then so be it. I'm their cheerleader. I'll do whatever it takes.
I love that.
Thank God no one's tested me on that.
Pass me the pom-poms.
Yeah, seriously.
Okay. So before we jump off this, I always like to ask my guests, if it was your sister, if it was your wife or your friend or your best friend, your mom, what is one tip or one, if you only listen to me on this one thing, this is what it is.
Go with your gut and make sure you feel a connection with your surgeon and you trust them.
That's it.
I mean, you really need that. You need that connection. You need to feel like you're in good hands. You need to feel safe. You look at their work. Is their philosophy on what they're doing matching what your goals are? Do you feel safe? Do you feel the connection? Will they get you through? If there's no surgery without risk, but will that person be there with you, holding your hand or doing whatever it takes to get you through it and get you out the other side? If you feel safe, if you feel good, if you feel like your philosophies are matching and what you're seeing that they do on a daily basis is what you're looking for, then I feel like that's pretty good.
Yeah, I think that's a perfect match. Definitely follow your gut. Always, always. If you have a bad feeling, if you're like, this doesn't seem right, or, this, whatever it is, doesn't make me feel good, then I think you guys, sometimes we rush. Oh, I want to have surgery and I want to have surgery in July and I have to have it this week. And this is the only day that I can do it. And we get like honed in, like, this is my time, but it's not. Like, take a step back. There's no rush. Literally, there's no rush. You do not want to rush this procedure. So if you feel a bad feeling, just take a step back and reconsider and maybe give it a few days and think about it. Really don't sign up for anything that makes you feel uncomfortable. Don't sign any quotes or don't give any deposits if you feel pressured. Definitely don't do that. If you don't the post-op, for example, if you're not going to see your surgeon after surgery and you're only going to see nurses and that doesn't make you feel safe, then take a couple steps back.
Yeah, this surgery, if treated right, should last you almost indefinitely. If you're not gaining significant amounts of weight, losing significant amounts of weight, this should last for the rest of your life. And for the rest of your life, to rush it by a week, by a month, it's totally not worth it. I tell people, this is such a long-term investment. You need to do it at the right time when you feel right. Don't ever rush plastic surgery.
I think that's the perfect ending. Don't ever rush plastic surgery. Take your time. All right, Dr. Rosett, I loved having you on. Your girls.
Thank you so much. You're
love
right.
Having
this went
you
really fast.
I told you it goes by so quickly. By the end of it, you're like, oh, that's it. We're done.
I feel this. You're right.
Hopefully you can come back on the show and we can talk about something else. Like maybe what other procedures do you have as favorites other than tummy tuck?
I love doing breast surgery. I like doing fat transfers. I stay below the neck for the majority of my surgery. I think that's what I do a lot of. And I don't want to take time to add a learning curve to do face surgery. So right now I'm all below the neck and I do a lot of that.
Beautiful. Oh, and I did want to tell our girls because they love hearing all the insider. Dr. Azizi and Dr. Rosett are friends, right?
Yes, we are social. We hang out socially.
I know our listeners are going to be like, oh yeah, I love that. They like hearing when doctors hang out.
Yeah. And it's funny because Dr. Azizi is a year ahead of me. And I always looked at his practice and said, oh, people like him. He does a great job. He's booked. And I was always like, oh, that's what I want to be one day. And it feels good to be following it and seeing the stuff that he and I spoke about or the stuff that he and I are now speaking about in reverse. So it's kind of nice.
Oh, I love it. I love to hear that. Before I forget, Dr. Rosett, where can our girls find you?
So Instagram is the best place. And that's where I post when I do post. ROSETTMD, Rosett MD. Facebook is also a great place. And if you look for Rosett Dolls on Facebook, that is the Facebook group that I am not in. So people can speak their mind. People can talk about their experiences and you don't have to worry about me supervising that. But they will tell you the good, the bad, the everything. And then if you want an appointment, going to my website, rosettmd.com. There's a link at the top that says book or change an appointment. That'll let you go on my calendar, pick a date or time. You can also call the office at 312-535-2200 and either leave a message on there or someone will help you book an appointment. Usually me.
Which is part of the very personalized touch.
Yes, exactly.
I love it. So I'll have you on soon and we can talk about maybe breast lifts because we haven't talked about breast lifts on the show. Dr. Rosett, I'd love to have you on in a few weeks and talk about breast lifts.
We can totally do that.
All right, then I'll see you in a few weeks.
All right, sounds good. Thank you so much.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com, You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.